crepitation, right? The crepitation, there are fine crepitations and coarse crepitation. Usually, when you hear with the stethoscope, wherever the lung is bronchiectasis, changes are there, you can get a coarse crepitation. Typically, bronchiectasis crepitations are called as. Question to you. What is the name of the crepitations of the bronchiectasis? Revati? Revati from Apollo? Can you answer, Revati? If you are there. Adnan from Latur. Adnan Abdul Qayyum from Latur. Can you answer this question? What is the typical pattern of crepitation that are heard in typically in bronchiectasis? Zainab from Deccan Medical College.
Coarse labyrinth crepes.
Who wrote? Zainab, your answer is right. Your answer is right. It's coarse leathery crepe. That is the typical description. I don't know how it's very difficult to appreciate that leathery feeling, but that is the name given to coarse leathery crepes is a typical of bronchiectasis. So it can be heard in just localized area if it is limited to one area, or it can be heard bilaterally, extensively, depending on the extent of lung involved. So then patient may have a rhonchi because there is a airway obstruction. Patient may have rhonchi like yesterday COPD in bronchial asthma. Even bronchiectasis patient can have breathlessness, rhonchi. You can hear the musical rhonchi, especially during expiration. So these are the clinical findings. They may come with fever. The sputum, especially the sputum, the amount of sputum that is compared to other diseases, chronic bronchitis and bronchial asthma and COPD, the amount of sputum will be enormous. Large amount of sputum they expectorate. If the patient says that I am collecting big mugs of sputum, that is one of the indications that it could be a case of bronchiectasis. When we were students in Osmania Medical College, Hyderabad, our teachers, our professors used to teach, like if you ask the patient to collect the sputum overnight in a mug, glass mug or a glass or something like that. The overnight sputum, if you ask the patient to collect the bedside, next morning, if you see, the sputum will settle in 3 clear layers. I don't know whether you know about this. The lowermost layer is thick, purulent, some just like pus. The second one is mucopurulent, and the top one is frothy, just mucus. You can separate out these 3 layers which is settling down if you collect the sputum overnight. That is very typical. Some senior professors, old professors might be fascinated to ask you this question. What is the sputum looks like? What is the description of sputum in bronchiectasis? This is the answer you have to give. That is sputum. Again, its sputum color, smell depends on what is the organism. You may find some streaks of blood. You may find if it is an anaerobic organism, you may find greenish sputum with foul-smelling sputum. And if it is little blackish, the sputum, if it is little blackish or brownish, you can even suspect fungus. In fungus, you have very common fungal infection, aspergillosis. Aspergillosis. Aspergillosis is a common lung. It can cause pneumonia. It can cause bronchiectasis. It can cause anything. It will form a ball in the lungs. You know what is the description usually given? There are many descriptions are given in a aspergillosis of the lung. What is the typical description given? Who will answer? Ball in a cup appearance. If you look at the X-ray, sometimes you will find this. There's this nice ball and there's a cup, nice cup, and there's a ball kept inside. It's semilunar shadow and a round shadow. Semilunar shadow and a round shadow. It's like a ball in a cup appearance. That is the typical of, this is called fungal ball or aspergilloma. We call it as aspergilloma. So aspergillosis of the lung, aspergilloma, also can cause bronchiectasis. And tuberculosis, again, very important thing. I cannot escape without talking about tuberculosis. Tuberculosis in our country, now it's very common. Chronic tuberculosis also can cause localized bronchiectasis, or if it is involving bilaterally, usually localized, it can cause bronchiectasis. So once the ectatic changes take place in the airways, it is a permanent thing, irreversible thing. I'll take a break of 10 seconds. 1 second. 1 second. Yeah, sorry. Sorry, yeah. So in tuberculosis, it may be blood tinged sputum, or sometimes what we call it as a bronchiectasis sicca. Sicca is SICCA, bronchiectasis sicca, which means it's a dry. Usually, the hallmark of bronchiectasis is sputum, excessive sputum. The hallmark of bronchiectasis is excessive sputum. But here in tuberculosis related bronchiectasis, sometimes you may not find any sputum. That's called as bronchiectasis sicca. Sicca is always dry, SICCA. Right. How will you confirm the diagnosis? How will you confirm the diagnosis? Okay, clinically you're suspecting there's a suggestive history, and you have to do some investigation. Sometimes if you do a blood picture, you may find some evidence of some infection. ESR may be raised. There may be some neutrophilic leukocytosis, suggestive of some infection. Then, of course, sputum examination, you have to do all the patients to see whether there is infection and what kind of infection, what is the causative bug, what is the sensitive antibiotic. So you have to do, because they come with recurrent infections. Even if you treat the present infection, there's no guarantee that he will not get, because there's a damage to the immune barrier that is there in the form of cilia and mucus. There's a big damage. So every time it invites infection. So that is why these people with bronchiectasis, they come to you with recurrent infections in this tract. So sputum examination, the gram stain, and the culture and sensitivity to find out what is the causative organism is very important. And if you are having a doubt, you also have to send the sputum always for the acid fast bacilli to rule out tuberculosis. And one AFB negative does not rule out tuberculosis. You have to do a serial of at least 3 to 5 days every day to send to the microbiology lab for the sputum examination of AFB. So if it